We can start with some of the most commonly used meds, and then we'll go to those that are less frequent to use. So the most commonly used group of medications are basically antidepressants currently. And one of the class of antidepressants are SSRIs, selective serotonin reuptake inhibitors. So you may be familiar with some of these names: Prozac, Zoloft, Paxil, Luvox, Lexapro, Celexa. And so how do these medications work? So this slide, although it may look very complex, it is about a important concept in neuroscience and in psychiatric medications in general. So we have synapse is basically is the neuronal junctions in the brain where two or more neurons come together, and these are very important places for signal transduction from one brain cell to another. So usually there are a number of different receptors and different ion channels involved in each synapse. And usually for most of the psychotic medications, these receptors and ion channels are the target and the way that medications work. So here we have three different neurons coming together in this picture. There is a presynaptic neuron on the top, which is bringing the signal to the synapse, and it's going to transfer the signal to the postsynaptic neuron, to the next neuron, right? So, and there are a number of receptors involved here. And in the basically red circle here, the red circle is pointing out those receptors that are involved in mechanism of action of three categories of antidepressants, basically SSRIs, SNRIs, and TCAs. That I'm going to talk about them later. So here, simply you can see that in the middle, it says SSRI in the middle of that red circle, which means that SSRIs basically impact the SERT receptor or the serotonin receptor here. And how they work is that they inhibit reuptake of serotonin, which means that when serotonin is released to the synapse, then it stays there. It cannot be reuptake. And when it stays there, it continues to activate the next neuron. And this is a basic way of like our understanding of how SSRIs help with the symptoms of depression, right? There are newer evidence emerging that questions this hypothesis that the main action of SSRIs is through serotonin receptors. This is our basic understanding, and then I will come back to the same picture for SNRIs and TCAs later. But the general idea here is that most medications either attach to a receptor or ion channel, and that's how they impact the signal transduction and help with symptoms.
We have a question, Dr. Mazen.
Sure.
Go for it. You want to hear the question and then you decide if now's the time or later to answer?
I see they say they can't see the slide. This is the question?
Oh no, I just texted Taylor Monique. I texted you. Make sure you're on gallery view and not speaker view. Anyway, I'll text with you later. Go ahead, Danielle.
My question is, what is your opinion of like those more recent findings that like this may not be why SSRIs and the other stuff work?
I don't know if you can hear me.
Well, I mean, it depends. I mean, those are significant findings. What we know is that we clearly know that SSRIs work from the clinical studies.
Right.
After basically controlling for the confounding factors and a lot of different considerations that go into clinical trials. But how they work is not known for many of the treatments that we have. So SSRIs are not only medications that we may not know exactly how they work, but we know they work. Ketamine is another one that we still don't know how it works, but it's now FDA approved and it is helping a significant portion of patients with depression. ECT is the same. Like we still don't know. We just know that it's a generalized. It has generalized impact on the brain, but we don't know how exactly and it works, right? So that's the thing. So here the idea is to explore very simple ideas about how these medications might be working to give you a sense of like what happens in the brain possibly. So we know that the serotonin increases in the synapses as a result of SSRI, but whether this is the reason that SSRI helps, we don't know that. But we know that the serotonin increases as a result of SSRI in the synapses. So yeah, and I think it would be I mean, I would love to take questions as we go alongside the slide. This is what I usually do. But I'm gonna definitely make sure to give enough time at the end to come back and explore any slide, any question. Veronica, you wanted to say something?
No,
No?
we're good. Thank
Okay,
you.
sure. So, indications of SSRIs. So we have FDA-approved indications that we use them. They're mainly depressive and anxiety disorders, major depressive disorder, bipolar depression, premenstrual dysphoric disorder, hot flashes, general anxiety disorder, panic disorder, social anxiety disorder, post-traumatic stress disorder, and obsessive compulsive disorder, bulimia nervosa. But also we use them frequently for off-label reasons like persistent depressive disorder, borderline personality disorder, body dysmorphic disorder, hoarding disorder, trichotillomania, somatic symptom disorder, illness anxiety, conversion, anorexia, and binge eating. And there are considerations when we are thinking about starting SSRI. One is the efficacy. So, sorry, I see someone raise their hand.
Yes,
Yeah, Pat, go ahead.
Sure, sure.
yeah, I just wanted to ask, why did you call them off-label? Just that they're found to be helpful, even though that's not what they were.
Right. So basically, FDA approved means that there has been a study with certain standards that FDA basically imposes certain regulations for clinical trials. FDA approval means that the studies have met those requirements and have shown effectiveness. So FDA approves that medication for that specific indication. Off-label means that there are other studies that are not meeting FDA requirements, but still there's some data that shows that this medication can be helpful in that area. And it is being used by clinicians. Sometimes there may not be even a study, but because so frequently they are used, that they come as off-label indication. So it's basically about the level of evidence.
Okay,
Right,
thank you.
of course. So considerations with SSRIs. In terms of efficacy, it takes usually a few weeks for SSRIs to start showing their impact, as is related to how they work, mechanism of action. The symptom domains that they may be helpful with are low mood, negative self-appraisal, anxiety, obsessions, fear, avoidance, anhedonia, and irritability. These are the symptom domains that we can expect to see some improvement in with these medications. In terms of side effects, some of the side effects may show up immediately, like nausea. Some may take a few days to appear, like insomnia or sedation or sexual dysfunctions. Some of the side effects are transient, some are sustained, like sexual